opportunity. I'm going to be moving around. In therapy, it's kind of hard for us to sit still. So as I go through this, I plan to just kind of flip through the PowerPoint. I'm gonna sit on a couple pages because there may be some things that may take a little more time to read. And as you have questions, just go ahead and just kind of shoot them out as we go. I would like to keep this open so that we can kind of have more of a dialogue, have a little discussion with this. So, aging and falling. Could this be me? Falling is a big issue, and a lot of people kind of have different perceptions on it and how it affects them and how it doesn't affect them. So some of the myths I've kind of listed on this chart. Falling, it couldn't happen to me. Falling is a normal part of aging, some people believe. People feel like if they stop doing certain activities, then they won't fall. They feel like these things won't happen if I just slow down. Sometimes the medication that you guys are given, you guys may be given, new medications that you may not be familiar with all the side effects, or you may be familiar with them, but it may affect your body different. There's also issues where people are learning how to use assistive devices. That's using a cane or a walker. And sometimes people feel like, man, I've had a fall once, only one time. And because of that one time, if I tell my family, I may lose my independence. So as we go through this, I want to try to help discuss some of these myths and some of these ideas that are realistic for a lot of people. Did you know the CDC, they stated that 1 in 4 older adults reported having a fall in 2018. They stated that 8 million had injuries and 32,000 of them didn't make it kind of after their fall. These numbers are going to grow just as our population grows. And as this happens, this also increases the cost of healthcare. There's this organization called National Council on Aging. They got a great website along with the similar to the CDC. They kind of share some of the same resources, but they pose some questions for people to think about. And as you guys kind of take a look at the screen, I've jotted down maybe the question or the thought and what could be the difficulty things that come with it. What could be the causes of it? The first one states, have I or a loved one fallen within the last year? Chances are it has happened, and chances are that it could happen in the future. Some people feel unsteady when they're walking. This is a sign of poor balance. And the question of, am I worried about falling? This person is more than likely to actually have a fall. There are some that may have a question of, man, I've got to go to the store, and every time I go, I have to worry about stepping up onto this curb. That's a sign. When people are concerned about that could be a sign of weakness. Others may have issues with numbness in their feet. The issues with numbness is with that lack of sensation, we can lose our ability to judge the types of things that we're stepping on or stepping over. Do we have enough clearance? If we're going upstairs, are we clearing the first part of that step to get up to the next level? The note here, falling is not a normal part of aging, and people can do things to prevent them. The picture on the left shows someone feels like this always happened. Hopefully the goal after this presentation, I don't want you guys to accept this. I want you guys to champion prevention. Find ways to prevent this from happening to you or a loved one. The biggest question of all, where should I start? What we're going to dive into here next will be several different groups of people that we come in contact with often, or people that we may have access to. This is kind of where we should start. Prevention starts close to home. Your loved ones, your spouse, they're with you every day, 24/7. They see a lot of the things that maybe you yourself, who may be having these issues, may not see. Your children are very similar. They may not have been around you for a while, especially with COVID. Your children may show up and, gosh, I've noticed, mom and dad, you guys aren't moving as well as you guys used to. Your neighbors, they're another person. That's another group of people. You can go out to the mailbox or just getting in and out of your car. They may notice some things that you may not have noticed. And also other friends in the community. If you go to a grocery store or a restaurant that you go normally, routinely, they may notice some things. One of the big things with these group of people, hopefully people are able to kind of find a way to be receptive to it. When these things happen, it's a challenging thing to confirm that, yes, this is me, but they're there to help. Another group, going to the doctor every year. This could be your primary care physicians. The primary care physicians are great sources to assist because they know your medical history and the progression of various health issues. They see people often enough to assist with recommendations concerning people that are fall risk. Your physician could also recommend evidence-based programs that are designed to reduce falls. They can also help to monitor your medications for side effects. Going to the eye doctor. Going to the eye doctor once a year is another great way to prevent having falls. Sometimes we lose our depth perception, if I can say it. We lose our perception on how tall is that step? Can I clear that curb? When I get out of the vehicle, I didn't realize that the edge of the vehicle was that high. Getting out of the shower at home. Now that leads me into foot doctors. Foot doctors are really great sources to kind of look at your feet. Some people have this numbness and tingling in their feet where they lose sensation, but it's a gradual thing. And sometimes people don't realize that it's happening. Your pharmacist. There's a lot of research out there that talks about with age, a lot of people are taking either medications or new supplements just to get the things that their body is needing that maybe they're not getting every day. Pharmacists are great resources because they know the side effects of different medications. They may look at something and look at all the medications that you've been prescribed and that you're taking. Maybe you're taking them at the wrong times. Maybe you should be taking them with food. And there could be many other side effects that could come with it. Pharmacists, they provide those counseling services whenever you pick up your drugs. It would be good to check in with them monthly when you go get them. Here's the other group. I'm a physical therapist, so I really get excited when I get to talk about the services that we provide and what we do. As a physical therapist, we're great sources to help with patients that are at fall risk. We perform assessments, try to capture their baseline to see where people are at. At a minimum, we're looking at how do you walk into the clinic? Can you get up and down from a chair? Are you using an assistive device the right way or not? The other things that we'll look at would be weakness, motor control. Are we having poor issues with controlling our bodies? Balance. Well, I mentioned numbness, gait training, walking with an assistive device, transfers. Are we able to get on and off, say going to the restroom? Are we able to get in and out of our vehicle? And other postural and there's tons of tools and things that we can assess and look at to get a baseline to really help people get to where they need to go safely. Here's just a few things that kind of support the things that physical therapy is able to provide. One study discussed the benefits of exercise. One single intervention of exercise, it reduced the number of falls by 36%, and it reduced recurrent fallers 41%. This looked at those that were living in a nursing home. This other study on here talked about, once someone got on, say, a home exercise program to work on strengthening and balance, it reduced subsequent falls significantly. In therapy, we always tell people we can do it. And if we can't do something, we'll always modify, but we're always pushing. One thing, so you don't have as much access to a lot of those resources on a regular basis. In the community, North Kansas City, we've got a lot of community wellness programs that address a variety of things for a lot of people. So with these programs, Shayna, she's a great advocate. She's actually the key person that can really help build bridges to get people kind of to those resources that we provide. In the community, there are Tai Chi programs and yoga, something else with medications, actively monitoring your medications each month, making sure you're maybe checking in with the doctor or your pharmacist, making sure that you're taking it when you're supposed to and how you're supposed to. And I just named a couple other resources. The CDC, they've got a steady program. It's called Stopping Elderly Accidents, Deaths, and Injuries. And they've got a whole program. The NCOA, it's another program. There's many other resources out there on the internet. If people don't have access, or if you're not able to get out of your home to go look into some of these other opportunities. So this next section here, what I want to kind of go into are some simple exercises that people can do at home to kind of help with standing balance. I'm going to try to demonstrate, hopefully if my camera allows. So be patient with me. So at the side of the counter, say in your kitchen, I'm going to raise my table up so it's high enough. It's always great to do this by holding on to something for safety. A lot of people like to really push the exercise and push themselves, but safety is really a priority. So the first exercise or activity that I have on the list is sidestepping at the counter. And I noted keep toes pointing forward. So we'll imagine that this table is your countertop at home. And simply what you're doing, we're sidestepping. My toes are pointing forward. And I'm stepping. I'm imagining I'm stepping over a threshold. That's one activity. The next one is high knee marching, walking at counter. I'm over exaggerating, lifting up the knees as if I'm stepping over an object. Heel walking at the counter. With this activity, I'm lifting up my toes and I'm walking forward with my toes in the air. The last activity is toe walking. I'm still holding on to the counter for safety because these things will cause you to be unstable. The challenge is to do these activities enough so that it builds the strength and it also helps to improve your balance and builds your confidence. On the next slide, we're going to talk about some strengthening exercises that'll be great to do. Here we're going to talk about sit to stands. Here, just for safety, we'll start out using our hands on the seat, on the armrest, and I'm pushing myself up. The other thing, to make it a little more challenging, I'm going to kind of stand without using my handrails. This activity can be performed in sets of 5. The other activity on there is heel lifts. This can be performed in standing. And simply keeping my toes pointing forward, and I'm just lifting up onto my toes, getting my heels up off the ground. Same activity can be performed in sitting. Again, a great way to start will be sets of 5. So this is my little quick tips for safety section. With gait training, a lot of people now, depending on what's going on, you find a lot of people using canes and walkers. Canes are used, so say you have an issue with, say, your right leg. The cane should be in your left arm. I'm sorry, Shayna.
There's a question for you, Larry.
Okay.
It's asked if you can show the side step again.
Show the what? The side stepping again?
Mm-hmm.
Yes. So with side stepping, my toes are pointing forward, and I'm keeping my toes pointing forward as I step to the side. I'm lifting up my feet as if I'm stepping over something. And what we want to do, we want to make sure that we're clearing the object. How was that?
Perfect.
Awesome. So when using a cane, my issue is, say, my opposite leg, you want the cane to be in the opposite arm. The issue is, say, when I step with the leg I'm having difficulty with, we want this cane to be there to assist with that step. I'm sorry. I know it's probably kind of hard to see. But, so I'm stepping, my bad leg is my right leg. So whenever this leg hits the ground, the cane touches with it to assist. At the very end of this, I will provide my contact information. So if there are other additional specific questions, I might be going through this kind of fast, but I'll make sure I try to help to clear some of these things up. The walker, the big thing with the walker is making sure that the height of it is correct. And I can help out with that, or any physical therapist, any physician. We can assist with the height of the walker to make sure that it's set up properly. Arm swings are important. A lot of times when people are on, say, a cane or a walker for a little while, we lose arm swings when it comes to walking. So we need arm swings to help with balance. If we're not arm swinging and we're just walking, that also increases our chances of falling. When it comes to transfers and we do sit to stands, sometimes the issue is, for some, let me show you this chair. And here's my walker. I'm gonna go to this chair. People they like to move the walker and push it kind of somewhere out of the way. And then we'll start reaching for the chair. And then when we reach for it, we sometimes miss it. To prevent that, we take the walker all the way up to the chair. We walk backwards until the knees hit the chair. Once the knees hit the chair, we find it with our hand and bring ourselves down safely. And then will be a great time to move the walker out of the way. The exercise with the sidestepping, where we're high knee walking, we're sidestepping, those are great exercises to help with climbing stairs. A lot of the times with stairs, when there's numbness or say there's weakness, we underestimate how high we bring our legs. And sometimes it's very easy for the foot to get caught on the steps. What if we fall? Don't do it. We don't want it to happen. We don't want to fall. So, a couple quick tips for if it does happen. If you go down to the ground at first you want to observe the scene, make sure everything around you is safe. You want to make sure you find a way to get yourself, into a safe situation. And then you start looking for objects to kind of help you. I'll kind of run through these really quick. I'll use this chair. So I'm on the floor and I'm falling. Okay, I'm looking for what can help me to get up. I found the chair. The goal is to turn around, get on all four. I'm here at the chair. I'm gonna bring my one leg forward. Bringing one leg forward will really help to give you the power to get you off of the floor. Once I get to this position, I'm gonna use my hands. This chair is pretty sturdy. I'm gonna use my one hand on my leg, other on the chair, bring the other leg forward, and then walk myself up tall. For more questions on this, we can certainly dive into that more as well. Go ahead, Shayna.
Is that your strongest leg?
Ideally, yes. Your strongest leg will be the one that you want to bring up first. Some people have difficulty with it, and they're in this position here. I tell them, grab your pants leg and drag that leg forward, because sometimes it's a struggle to get this leg out here. So grabbing, pulling that leg forward using your pants leg, whichever way you can. But yes, it's your stronger leg. And that's it.
Larry, thank you. That was absolutely great. I know I learned quite a bit. Is there anybody that has any other questions for Larry? Larry may have done that bit of a job.
Oh, thank you. Thank you. I'm sorry, I just found out where you can see the questions.
I love it. I love it. Okay, Larry. Well, guys, I'm going to wrap it up. Thank you, Larry, from Physical Therapy. See, I found my words. There is his information, guys. Reach out if you have any questions. You can reach out to me as well. And like I said, this is going to be put on YouTube so that you guys can reference all the activities that Larry has shown you, and you can work on those. Definitely be as safe as we can, all right?
Thank you.
Have a good day, guys.